Hello and welcome to the Mental Health Advocacy Series. We're back with another great conversation this week. The focus of this series is mental health and Black community. With this series, it's our desire to share information with the community on topics such as understanding what mental health is, myths and stigmas about mental health, generational trauma, therapy, and other resources, and barriers that will help and much more. Today, we are talking about mental health myths and stigmas. I'm Kanika McBride, and I serve as the Trauma-Informed Educational Specialist with Greater Richmond SCAN. I'm joined by my colleague, Tamika Daniel, who is the Behavior Health Community Organizer for Greater Richmond SCAN. Tamika is an East End community resident and mother of 4 children. She's began advocating for needs of her son who has autism, which led her to advocating on a larger scale in the 10 years of her not being employed. She began as SCAN's Behavior Health Community Organizer in August 2019 through a partnership with Richmond Memorial Health Foundation. Utilizing her expertise and experience, she brings SCAN's work in adverse child experiences trauma and resilience to the community through training and forums. She also assists in building resilience and facilitating healing through empowerment and connecting through a trauma-informed and equity lens. Additionally, she brings her voice and advocacy to meetings and tables throughout the community. I also have the pleasure to introduce our special guest, Tasha Moore Elamine. Tasha has served inner city youth and their families in a variety of capacities over several years after graduating from VCU with a BS in psychology. She's had experience in the areas of early childhood education, school-based behavior counseling, in-home counseling, alternative school-based counseling, foster care, and private agency placement, social work in the areas of reunification and permanency, supporting children with disabilities and community engagement, coordinating for both RPS and now Boys and Girls Clubs of Metro Richmond. No Crying Aloud represents how children at times display a manifestation of trauma based on their experiences of adverse childhood occurrences, as well as how this impacts children with the school system, specifically around the topic of anger management and social emotional regulation. Being able to publish books with topics related to experience adversities, specifically through the depiction and multicultural characters, is a market that Tasha believes is minimally represented at a disadvantage to our youth. Publishing NCA allowed Tasha, my apologies. Publishing NCA allowed Tasha to be a conduit of conversation starters, much needed with our community surrounding, encouraging youth to expand their literacy skills through reading, encouraging youth to find inspiration while being exposed to positive, useful solutions through characters who not only look like them, but have experienced similar situations. Giving knowledge and alternative methods for our educators, parents, and community members to interact and support our youth who are struggling through the impacts of trauma, and giving voice to our youth who are often forced to journey through life with minimal understanding or empathy toward their daily struggles. Today, Tasha, Tamika, and myself will be talking about the myths and stigmas that we know still exist today around mental health, especially in the Black communities. So let's jump right in. Discussion questions I will be presenting to all of us will be, the first one is, what would you say are the biggest myths and stigmas about mental health, generally speaking, then considering the Black community specifically? Who would like to start? And let me know if you need me to repeat that question.
I'll go ahead and start. I feel like generally the stigmas surrounding it are being able to recognize the need for help, the need for support, the need to just be honest about the experiences that we have as a people. I think I'm hoping that we're kind of over the hump of where COVID has put us in a large capacity in terms of a collective experience of trauma. But I like to utilize that as an example because that is the first time that I feel like we all have been represented in experiencing a collective trauma from a worldwide experience, a national experience. Um, and I think it is now that because it's worldwide, there's been more emphasis placed on mental health and being able to engage in self-care and being able to recognize how we've all had to adapt and how it's impacted our lives. But that's not the only thing. It's never been the only thing. There's so much that has transpired in the world that has caused us all to be functioning at a level of trauma. But it's become more of a conversation starter and a topic in regards to your self-care and your mental health. But I think the stigmas that are still there are surrounding not self-diagnosing, like the necessity to actually go to have an assessment, to find a therapist, to actually engage in some type of therapeutic practices and not just having conversation about, girl, my anxiety is off the roof today, or I just feel super depressed. I don't feel like being bothered. Those are like key terms that widely are used, but not necessarily actually a diagnosis. And I think when you have a diagnosis on paper, it creates internal stigma where you feel like you're diagnosed as somebody that's crazy or somebody that can't control themselves. And I feel like that oftentimes prevents people from being intentional about taking that step. One, and then I think in regards to the Black community in specific, the stigma is we got enough, we got enough that we dealing with. Nobody gonna label us as crazy. Ain't nobody gonna tell me that I don't know how to take care of my child. Ain't nobody gonna tell me that I don't know how to take care of my family. Yeah, I got all of this stuff going on, but it ain't none of your business. And what happens in my house stays in my house, especially when I see the communications happening between a parent and a child. Like there is no conversation about how you feel. You do what I say and that's it. And not to say that every household is run that way, but that's part of what I've seen and just the work that I've done in working with families in the community, is that oftentimes the support that is being sought after is reactive and not preventative. And most times it's because somebody has told a family member or a parent that you got to do it in order to get in-home services or mental health services or as a part of an IEP or whatever. It's not something that is really intentionally sought out by the parents, by the guardians, by the families. And like I said, in a preventative way. And oftentimes because you don't want anybody else involved in your life. You don't want to be stigmatized by the society because us as a culture are already stigmatized in so many ways. And you don't want to add that to the list. But that then creates such a barrier in being able to really address the needs that we have as a community and as a people and staying ahead of our own well-being and not about the other people that are involved, but being able to have agency over your own life and your well-being and your health.
I couldn't agree more. Just piggybacking off of what you said, for me, some of the myths and stigmas, like when you hear the word mental health in general, it's always associated with being bad. Like
Mhm.
that's all I ever used to associate it with. And now that I know more about it, it's like it's more to mental health than it being bad.
Mhm.
And then, specifically speaking to the Black community, like you said, that it's a shame associated with, even talking about mental health. Like,
Mhm.
it's like that's not acknowledged. Like you said, for most of us, for some of us in our household where we grew up at, that's not acknowledged. Or
Mhm.
it's like, the ancestors went through worse. Like, you suck it up and keep it moving. So it's like
Mhm.
your mental health is not acknowledged. And then you being a child, like you said, you ain't really had no say so. It's you
Mm-hmm.
don't pay no bills in here, so you're gonna do what I say. And you know, you don't have no say so. And you know, I'm glad I'm different with my children. I actually give them a voice. Because I feel like that's been one of the biggest ones plaguing us is that, you know, we don't deal with mental health issues. That's not
Mm-hmm.
us. We naturally strong people. So, you know, what you mean? Ain't nothing wrong with you.
Right.
Mm-hmm.
And I think one of the things that Tasha said is that, we grew up during a time where it's like, and even still now, you'll hear people say, what goes on in our house, stay in our house.
Mm-hmm.
And so that, kids don't feel comfortable with being able to talk to their school counselors or social workers. And because there is like a stigma attached to it, like you're crazy, or, if something is wrong with you, then that means something is wrong with your parent. And sometimes parents will be in denial about their own struggles. And so then they will not allow those kids to have that voice to be able to advocate for themselves. So then they don't know how to then advocate for their children because they're in denial about having those same issues themselves.
Mm-hmm.
Hmm. You don't want those, excuse me, you don't want those labels based on you. I've had plenty of people tell me, you know, when I talk about them, you don't want them labeling your child that's going to follow them. And it's like, I get that, but I'd rather them, you know, get the resources that they need, that they're entitled to, than to not have that on paper and they're just going through the school system just because I want to pretend that it's nothing going on.
Right. Absolutely. Get them the help that they need, like you said.
Yeah. And that was one of the things, sorry to interrupt, Kanika, that was one of the things that I oftentimes in the roles of working with families, especially in the school system, was trying to be intentional about the conversations had with the parent or caregiver about what things are you actually seeing in your child, like what behaviors are you seeing, what patterns are you seeing, being honest when you have a social worker or whatever coming to you to complete a social history. Those components of you actually going through an assessment process are important for you to do because it gives history of your entire family. It gives history of all the things that has transpired, in your generations. And sometimes there is a level of having to determine why you're seeking help, what you're trying to get out of it, and where you really fit into that scope of attaining support for mental health, especially when it comes down to the school system and IEPs. Oftentimes what I see is children being brought to the eligibility team because they're having issues academically in terms of their focus or being able to meet developmental requirements or what have you. But it's so easy for our children to not be able to do those things because of the traumas that they have experienced, because of the environments that they live in, because of all the external factors. And when I would be having conversations with parents in a supportive role, like, let's go and look through the honesty of the life that you are living. Let's go through and look through the things that your child is being exposed to and how you as a parent or you as a caretaker can be addressing some of those things before you decide to go through the whole eligibility process that will then create a requirement for your child to be on this plan for 3 years at a minimum and be labeled. I would never be against a child being able to get that level of support if it's actually necessary, but also don't do it because it then provides that label that you can then take to SSI and get you a check and get you some more money. Because that's not what it's all about. It's about you being able to realistically recognize the patterns that your child have or that you have as an adult, and being able to go through the entire assessment process to determine whether or not you actually have some type of diagnoses. And like I said, when you're going through that process of the social history in the background, being honest and open and vulnerable. And that in and of itself is something that doesn't come natural, especially within the Black community, because the realities are most of the people that are doing those assessments don't look like us. they're Caucasian, or there's somebody else that you already have somebody that is not within your immediate culture coming in and asking you questions that are requiring you to be vulnerable, that are requiring you to tell a part of your journey, your story that you haven't even admitted to your own self oftentimes. And now you're telling it to a stranger. And then the next time you see somebody else, it might not be that person again, because working in this field, there's a lot of transiency in it. Miss Kanika was in this role for 2 years, and my family been in here for 3 years, and now Miss Kanika gone because she done elevated, went somewhere else, and then now somebody else. And I don't know how I'm going to develop my rapport and my relationship with a person that I don't know. And that's a barrier that we have within ourselves too, within our culture of the Black community, is knowing how to trust so that you can actually go through the process accurately. That's the piece that I wanted to add into that.
I absolutely agree. We're going to move on to the next question. And it says, why do you think myths and stigmas exist? I think we've already somewhat hit on that, but if there's something else you would like to add, feel free to.
Yeah, I don't think that I would add anything. I think we just, as a culture, like I said, just have so much catching up to do in regards to the ability for us to trust other people, and to be able to be okay with being vulnerable in the areas that are so hurtful for us. And how can we do that? And that kind of brings me back to the conversation that I was a part of, the other panel that you and I were a part of, Kanika, and just developing more intentional conversations so that mental health as a topic in and of itself can be widely communicated amongst all of your groups of people, whomever you're connected to, so that when it does come up, it doesn't seem so passe, it doesn't seem so difficult of a conversation to have, even down to being more specific about when somebody asks you a question, like, how are you? That in and of itself is a mental health driven question, but we oftentimes avoid the realities of how we really are. And if we become more apt to being able to answer honestly, then it starts creating that open dialogue and breaking down the layers of what it will require you to be vulnerable when you are actually going into an assessment or something with somebody that you don't know. The simple question of how are you, don't continue to give those cookie cutter answers like, oh, I'm blessed and highly favored. I'm good, I'm okay, I'm fine. Okay, yeah, I agree that you're blessed because you're alive, you're here talking to me. But how are you really? Are you tired? Are you lonely? Are you anxious? Are you feeling depressed? Are you feeling down? Like, those need to become more common language that we have when we're communicating with each other, in terms of breaking down those myths and those barriers, because then it's not just readily going to the language of, oh, you crazy, when somebody say, I done had a hard week. It was hard for me to get out of the bed. I didn't want to talk to nobody. I didn't want the lights on. I didn't eat. When you hear somebody say that, you automatically throwing up red flags like, ooh, you might be bipolar or something. And then that's kind of how we talk to each other. But that then creates more of the bias, because you can't just throw out those terms without you actually knowing what that means and actually going through the process of recognizing the patterns that are connected to that. And then, like I said, not self-diagnosing, and being able to be intentional about seeking your care.
Yeah, so that ties into exactly what I was gonna say about why they exist, because for me it's the lack of information. Like I said, whenever I would hear about mental health, it was always in a negative way. So for so long I struggled with what I was dealing with because I felt like it was a bad thing to talk about it. Like I shouldn't be feeling like I need to talk to somebody, like it's, something wrong with me. Or when I say I want to talk to somebody, it's always what's wrong with you? As soon as a Black person in our community say they want to talk to somebody or I want to seek therapy or whatever the case may be, it's always what's wrong with you. I can't count on how many times when I told people I'm in therapy, they said, what's wrong with you? And
Mm-hmm.
nothing was wrong with me.
Mm-hmm.
But I had got to a place where I realized for most of us, it's not that we stressed and depressed from the stuff that's going on in our life. It's that we don't have the coping skills, and it just leads to everything being bottled up. And that's where the stress and depression come from, because we don't even have the basic skills to deal with everyday life. And that's what it was for me. I had no coping skills
Mm.
because of those myths and stigmas. I can't talk about what happened to me because, my family might feel some type of way.
Mhm.
So for me, I feel like for a lot of us, that's why those myths and stigmas exist, because it's always been looked at as a bad thing.
Mhm. And just
Absolutely.
real quick,
It
I would.
became the norm in our community as well. Like
Mhm.
for us to say, there is nothing wrong with you, or did you pray about it? And not saying that people should
That's
not
a
pray
good
about
one.
it, but prayer doesn't have to be everything or the only thing that we
Mhm.
do. And so I think that again, they exist because they become our norms. We have not been able to vocalize as Black people, and still today, we feel some type of way because we're already behind somewhat. And so then when we name those things of how we're truly feeling, then we're looked at a little bit different than other, communities. So I think that that's one of the reasons why they still are so prevalent today and exist today.
Mhm. And the point that Tamika made about her communicating that she was going to therapy, and us within our own culture are saying, well, what's wrong with you? That's one of the things that I would impress upon the teachers in the school system oftentimes, is getting that language out of your head. It's not about what's wrong with you, it's about what happened to you. If you just change that one word, I think that creates a different sense of vulnerability, or at least even a sense of introspection. Like, you didn't ask me what's wrong with me, because what's wrong with me is going to automatically put me on the defense. But what happened to you puts you in an introspective space where, what did? And then we can work back the layers from there. What do you mean, what happened? Well, tell me more about what happened to you before you came here today. Like, I noticed you came into school automatically with your guard up, like, no eye contact. You don't want to talk, you're in a bad mood. So I just want to, as your support system, figure out what happened. And then that's what starts to happen in peeling back those layers, like I said, of being able to develop that language, first of all, and then being able to open up the doors of, let me really think through this, so that, like Tamika is saying, you can start developing your own internal coping mechanisms, because you're starting to have those conversations with the people that you're connected to the most, the people that you actually trust.
Absolutely. Absolutely. And then they connecting the right emotion, like you said, to what happened to them versus what's wrong with them. Because they just said, once they get on the defense, it's anger. And we sometimes get comfortable with that being our only tool, anger and fighting, that fight, flight, or freeze. And so I definitely think that they should add what happened to you versus what's wrong with you. That would definitely be a different type of conversation starter.
Mm-hmm.
We're going to move into our next question, and that's what do you think keeps these myths and stigmas present? What keeps these myths and stigmas present?
I'll start fear. For me, it was before I actually took that step, it was the fear of what's in front of me. If I do decide to address what happened to me, what's gonna happen? I was scared for so long about dealing with what happened to me, even when I was coming up, from being exposed to certain stuff in the community that I lived in, to even being a victim of domestic violence. It's like, how do I even begin to unpack all that? I don't want to deal with that again. I got to talk about it. I don't want to deal with that.
Mm-hmm.
And it wasn't until I watched how I was affecting my children still, with all of that stuff that I was still holding on to, how it was affecting the decisions I was still making regarding men that I kept company with, just everything in itself.
Mm-hmm.
Um, I've always had a fear of the unknown, always. So I think for a lot of us, it's that fear of what's going to happen once I do unpack this.
Mm-hmm.
It's almost like you're opening a Pandora's box.
Mm-hmm.
So, for some of us, it's easy to stay with what we're used to,
Mm-hmm.
how we're used to moving, how we're used to feeling. Having to go in and unpack the stuff that I dealt with in therapy, when I say that was the hardest thing I
Mm-hmm.
ever had to do in life,
Mm-hmm.
because that look in the mirror and that self accountability came in, and boy, oh boy,
Yeah.
it was hard.
Mm-hmm.
So it takes a lot. So I'll say for me, it was, it was fear.
Mm-hmm. And I
And
was,
lack of huge.
and lack of knowledge. Yeah. Mm-hmm. And I was going to say, to add to that, and to use the word that you also mentioned too, Tamika, is that accountability. Because even if you do take the step to go to therapy and start to unpack things, it then becomes an accountability layer of what are you going to do about that? And then you circle right back to fear, like, oh, me doing something about that means I got to change my circumstances. I got to change my environment. I might got to change the people that I'm connected to. I got to do all of these different things. And then you circle right back to fear again. Like, but that's too much for me. That's too much for me to manage. And then it also comes down to that coping skill piece that we talked about too. It's like that revolving door, that cyclical pattern, because even when you do feel that fear, what coping skills have you acquired or developed from that point to be able to break past that? So that you don't get stuck in that fear stage and then you don't make any progress. And then to me, that circles back to a part of what could be missing too, especially within our culture, to go back to the word accountability, because we sometimes need accountability partners. Um, People that we feel like we can trust, that when we get to that layer of fear that is stopping us dead in our tracks to actually do something about it, having somebody that you feel like is going to support you through the process, that on your hard days that you can't do it or you're so fearful, to be like, listen, I'm gonna hold your hand through it. What do you need me to do? How can I help you? And then, like you said, to your point, Kanika, that knowledge, because um, navigating the mental health system is tricky, it's confusing, it's too much. And the layers of how much that it would take for you to go through a whole process can even start down to, sometimes within our culture, we don't even have um, the knowledge, like in terms of our fluency and being able to read some of these documents, these words that are on here. Somebody explaining to you what this means before you sign in something, so that you even understand what it's asking you, not just throwing a bunch of paperwork at me and I'm supposed to fill it out and that's it and I'm going to the next thing. Being able to have somebody that's going to walk you through the process so that it can not seem as strenuous and so difficult, and so tedious of a task, especially because within our culture too, we struggling with balance and all the things that we got on our plate. So finding time at the end of the day to really read through documents and fill them out so you can go to the next phase of your assessment, it can be a challenge in and of itself, because you don't even have that window of time to be able to do it, let alone being able to understand what it is that you're reading or that you're applying for. Um, and then the navigation of the system too, when it comes down to all of the predisposition that you got to have before you can even qualify. For somebody that is just generally feeling a level of anxiety or a level of being downtrodden and not being able to have the coping skills to get up and get involved in something, that in and of itself should be enough to qualify you for something. But when you look at all the criteria of, oh, well, I got to be on medication, oh, I got to have been hospitalized, or, oh, I got to be in some type of crisis, if you are then looking at that and you don't qualify for those things and you feel like you can't do nothing else about it, and sometimes it's unfortunate that you can't, because then it's like, again, it's not preventative, it's reactive, to the point that I don't qualify to this point and I gotta wait till I really get down and I really start acting out because I don't have the coping skills, and then I do something to harm myself or somebody else, and then that what makes me qualify. But at that point, you are extending the level of challenges that you're having. And it's unfair. It's unfair to the person that is really just trying to seek genuine help from the get-go, because it's just too much to navigate.
It
Right.
really
And so your,
is. It really is a lot to navigate. How I ended up with therapy is I tried to get a restraining order um against the person that had committed those violent acts against me years ago. And they asked me did I need any help, and I ended up checking counseling. But it's like me just going into my doctor's office, if they ask you those questions and you even answer them honestly, the first thing they're going to try to hand you is a prescription.
Mm-hmm.
So what about the people who are not in the space like me and don't, have that courage to, feel empowered to push past that and tell them no? Like, even though they're a doctor, to tell them, no, you're not giving me no medicine. I don't need medication.
Mm-hmm.
I'm just struggling with everyday life. That's
Mm-hmm.
it. I just need to talk to somebody.
Mm-hmm.
And that's what happens with a lot of other people. And I don't even want to talk about the other stuff that lead into with them prescriptions when they just throwing them at you.
Mm-hmm.
That creates people who don't want to, like you said, they don't want to talk about it. They don't want to ask for the help because, like you said, the process is just, it's too much.
Mm-hmm.
right. And I definitely think, like you said, if they're just giving you prescriptions and not really managing them, then that can open a door to another issue or problem, And then, as to your point, Tasha, like you said, sometimes they're not waiting till it's too late. I guess it's not ever too late to seek help. However, by the time that all of these things have occurred, now consequences are connected with them. When, like you said, they could have been proactive and preventative so that they would not have to be reactive and, punitive and on the tail end of it.
Mm-hmm.
What do you ladies think will be, how can we start challenging or ways that we can reduce these myths and stigmas?
I would connect this to something that Tamika said in terms of her going to the doctor. That is a different conversation, but it still connects to me because that's another issue that we have within our culture, that we aren't seeking active appointments, maintaining our annual physicals, our annual gynecological visits for us women, our 6-month dental cleanings. Like, it has become more of a widely used practice in any of those settings that they're asking you those questions. But if it's anybody like me, who has gone to the doctor, if you don't have a regular provider who knows you, and you just have maybe a nurse practitioner or whoever might be filling in for that day, they don't know you, and they just checking the boxes on their computer. If you're not answering honestly, they're not even giving you eye contact sometimes. They just typing in and they're going on to the next patient. But you are the one that has that medical insurance. You paying that premium, or the state paying your premium if you got Medicaid, whatever. So you got agency enough to be able to use your voice in those settings to be able to say, listen, I am feeling these things. I don't know what to do. I'm in this appointment. You asked me these questions and now I need some help because you asked me. When have you felt like you can't go on in the last 10 days? Check that box. Yes. You asked me that question and I need help with that. I don't know where that feeling is coming from. I don't know what to do about that. And that in and of itself, like I said, if you are maintaining your appointments, can be an open door right there, to be able to have somebody asking you those questions so that they can then give you those resources. So maintain your doctor's appointments. Maintain using the resources that you have available. For instance, if you're a full-time employee, you can check into whether your job has an AEP program, your I forget what AEP stands for. But your AEP program
EAP?
or EAP.
Yeah, I think that's what you're talking about. And I don't know what the acronym is, but I know
Yes.
that does give you access to be able to tap into, services with therapy, therapists and counselors. And typically, sometimes they're free. The first 5 to 6 sessions are free.
Right. Yeah. So being able to utilize the resources that you have available that you oftentimes are already privileged to have, but you don't necessarily know because it's not really something that is talked about. Like when you first start somewhere, Usually human resources is supposed to go through all of those things with you, but that doesn't always happen. So staying on top of like the ready-made resources that you already have, the EAP, like Kanika said, will sometimes give you access to all of the providers within your network that are oftentimes free. And you can go to a therapist for the first 4 or 5 sessions for free to be able to start that conversation. Because that's another thing, money is an issue. Therapy is expensive, especially if you go to somebody that, you know, is qualified and somebody that has been practicing for a while. You can spend upwards to $100 a session sometimes. And in this economy, that's not money that you have to afford. And mental health, unfortunately, is something that you put on the back burner. Like if I'm gonna spend $100 for a therapy session, that $100 could go to feeding my children, can go to paying my rent, can go to paying my car payment or gas or whatever. So the hierarchy of needs are an issue when it comes down to how much money you can have access to actually pay for these things. Especially even if you got to pay for medication or you got to pay for a specialty visit or something, you know, those things are expensive too. So that is a whole nother conversation too, and just access to healthcare and the ability to actually have the tools readily available for you.
That's one of the things I was going to say as well. To be able to reduce some of these myths and stigmas, we have to be able to have access to healthcare, making it affordable or accessible, because even though they have, well, like sliding scales for some healthcare providers, or we don't always know how to access it. You know, we have so many barriers to get into it where that you have to sign up online a lot of times. And so a lot of people in our communities may not have access to internet and things of that nature. So just being able to access healthcare for our community will be one way that we probably, well, I know for sure we'll be able to start reducing these myths. And then there was another thing that you had said, Tasha, that I wanted to piggyback on, and of course I draw a blank. Well, and I mean, Tamika has said it about fear, making it okay to talk about it. Even with starting with your family and your friends. Stop, you know, throwing around those terms and diagnosing people or throwing around those terms like just in casual conversation, like it's funny, like it's not. Like start having serious conversations with people that you care about so that they know that it's okay to talk about those things and actually seek help for them as well.
Yeah. And I was just gonna piggyback on that, Kanika. For me, it was that same thing, and I feel like how we continue to challenge those is just for the people like me and you and Tasha who, you know, have, you know, more knowledge on this, to just keep sharing, like with our family, with our community, just continuing to do that. Because like I said, when I would hear about it, I just heard bad things about it. So it's like now that I know more, I share more. And that, I feel like that's the only way we're going to be able to do it, because unfortunately for some of our communities, the lack of resources that are put there is a big problem. And that becomes an issue with challenging these myths and stigmas, because how are we going to talk to people about when they get help, and then they can't access it like you guys said. And so, you know, just making sure we keep doing our part to keep getting that information out. I know since I started with SCAN, I be talking my little head off, and you know, I'll just say a few of my family members had started to, you know, go to therapy. You know, my dad is what? My dad will be 55 this year. He just started talking to someone. And that's hard for a man of his age, where we come from and some of the things he's been through. For him to actually take that step, I've never been more proud of my dad than when he told me that. So it's like, you know, just, you know, being that person in your community and your family, and just keep telling people that it's okay, and me showing them what therapy did for me. I know therapy doesn't work for everybody, but just letting them see what happened with me and the transformation I had by me actually opening up is, I feel like that's another way we can keep challenging it.
And that's fantastic that your dad was able to do that and just allow the process to happen. our men is a whole nother case, you know, and just being able to have them be okay with that vulnerability and recognizing that you don't just have to be strong. You don't just have to show up and be the provider and take care, and not actually have days where it's too much of a challenge for you. It's too difficult for you mentally, not shutting down the necessity for our men to be aware of their feelings and just where they are, which was part of the reason why in me writing the book, I was intentional about creating a male character, because we start very early with communicating with our males that it's not okay to cry, it's not okay to show weakness, it's not okay to be vulnerable. And then you start internalizing all those things, and it comes out in external unhealthy behaviors. And if that is a repetitive pattern within our own communities and our own families, that's how we start creating that generational buildup of a lack of accountability towards what you actually feel, where you are. And then it leads to that school to prison pipeline, drugs, gangs, and all the other things, because you're making up for the stuff that you feel internally that you haven't really addressed. Which I can get on my soapbox about that. But the only other thing that I was going to say in terms of being able to have agency or independent accountability to help is using your voice where it matters. If you have children that are in the school system, don't be one of those parents that your teacher, your school counselor, your psychologist can't reach you, because you are that pipeline to your child, and you don't want the people who don't really know your children or your family to start putting things in place without your permission, because you are the one that knows and they can provide that information. You also are the ones that are dictating what happens in our school systems. Don't be those parents that don't sign up for the PTA or don't go to school board meetings when they're scheduled. And obviously that's, again, easier said than done for quite a bit of our families who are working multiple jobs, or who may be a single parent who doesn't have that support of where my kid's going to go if I go to this school board meeting. But take them with you. Listen, we're going along because I need you to see me. I need you to see mama or daddy or whoever advocating for you, because at some point you're going to be in these situations where I'm not going to be beside you, and I'm going to need you to learn how to use your voice to advocate for whatever it is that you need. The other advocacy part that I was going to say too is for those parents who have been able to, or those people, even adults, have been able to navigate the system and are receiving services. Don't just settle for anything. That's how we have all of these agencies that are not quality, because people are getting to the work and doing the work and they're not providing quality care. If you got an in-home worker, you got a skill building coach, you got a whoever that's supposed to show up for your appointments, if they not there, use your voice to call that agency and say, listen, so-and-so didn't show up twice already, or they showed up and they on their phone, or they not paying attention, because you're not getting quality care. And if you're not using your voice to advocate for the care that you're supposed to get, then we'll continue to have agencies that are not providing that level of care that's necessary to be able to say, I've gone through this and I actually can come out having built some skills, coping skills, money management skills, whatever skills that you're acquiring. Because how many of us can say that you've gone through that and you actually are seeing results? If you don't feel like you're seeing results, you don't feel like your child or whoever is seeing results, then who do you need to talk to? And be intentional about having those conversations.
Absolutely. Absolutely. Thank you. Our next question, the next to last one, is what are some individual and community action steps we can take to help get rid of myths and stigmas in the Black community? And I know we talked about this a little bit, but ones that we want to definitely point out, we'll bring them back around. So what are some individual and community action steps we can take to help get rid of myths and stigmas in the Black community?
I'll go. And for me, it's continuing to use my platform, having conversations like these, continuing, like I said, to just talk my little head off. And like I said, the reason why I'm so passionate about advocacy work is because of the fact that my oldest son has autism and I had to fight and scramble and scratch for all of the resources that he received. And if I can prevent any family from having to go through that, then that's what I'm going to do. So for me, the personal things is just continuing to use my platform to share knowledge and resources.
Absolutely. And I would say too, like individually, like you said, Tamika, being the example that you want to see, even in your family, starting with your family, being transparent, in your communities, to let them know if I did it, you can do it too. I feel like that's on an individual level, being that for your children, as Tasha said, come on, go with me so that you can pick up this tool or learn this tool of advocacy. And then the community action steps, as Tasha already mentioned, challenge the agencies that you are accessing to be what it is that you need. Do I see a change? Having an initial expectation conversation with them about a timeline or a time frame, or what am I going to get out of this? And holding them to that, making sure that you're receiving quality service. Stop settling, especially in our communities, for, the minimum, not a great quality of service. No, we desire and we need and we are worth a good quality of service being accessed for ourselves and our families. And so I think we've already hit on that, but making sure that we're holding people accountable about the services that we are receiving and making it okay to talk about it.
And I mean, I agree with all that you all are saying. And I would just say we oftentimes do it to ourselves to a fault. And it's disappointing and it's frustrating, because I would even speak for myself. When I'm going to look for a doctor, a therapist, a provider of some sort, I want to go within my own culture, because I feel like there's already a level of understanding, like at least minimally, you kind of know some of the stuff that I might be having a challenge with because you can relate. But sadly, sometimes when we go to our people, it's not quality. And we got to learn how to hold each other accountable. Hold each other accountable for the types of examples that you gave, Tamika, where you talking to your family member and you saying, I'm going to therapy, and your family member immediately responds with, well, what's wrong with you? You crazy? Most of the time we just shrug that off and move on because we know auntie so-and-so, we know uncle so-and-so, that's just them, that's how they talk. But no, we got to start peeling back those layers of, again, making it a commonplace conversation to be able to say, well, but no, I'm not crazy. Now, I might be struggling with some things, but that's the reason why I'm going to therapy. And actually, you need to go too. Let's go to be accountable, bring somebody along with you. Like we talked about, like, listen, sis, listen, uncle, listen, brother, listen, husband, wife, whatever. I'm struggling. I need some support. I don't want to make you feel like you need it too, but these are some of the things that I'm noticing, and I would love for us to go into it together, so that it doesn't seem like you're alone, because that can be half the battle in and of itself, that you feel like you're doing stuff by yourself and you just don't have the time or the skill set or whatever to be able to do it. Take somebody with you. And again, being able to be open to have those conversations, because sometimes healing in the journey comes from just sharing your story and being vulnerable and talking about it. And we as a culture are so used to just picking up those bags and keeping it moving because we got to, but you don't have to do it alone, in the sense that sometimes when you just sitting down and you just sitting there, you at lunch, it's easy to start talking about what happened on Real Housewives or whatever might be happening with whatever. But sometimes you got to start having those conversations like, man, I had a hard night last night. Like, I had a hard time sleeping, or I just been dealing with this thing that I can't really get over, and I'm just using this time to be able to vent. And sometimes that just creates, again, another level of being able to start having those difficult conversations. but also you just never know who is going through the same thing unless you start building that community and having those relationships. And again, that could be easier said than done because you can't trust everybody with your circumstances or your situation. So you do have to be aware of who you're talking to. But start putting your feelers out there of people that are really in your network, the people that you see every single day, that we all walking around looking like we got it all together, but that's because we just so used to doing that. And like I said, just start having those conversations so that you can be relying on somebody else that, like I said, may have struggled through the same things that you're struggling with, and you never know because you just never opened up your mouth.
Can y'all hear me?
Yeah, we hear you
Yeah.
now.
Yes. Okay. My screen had froze a little bit, so I just wanted to make sure. So we're going to wrap up. There has been a lot of great information shared here, but I do definitely want to give y'all this time, or each of us this time, that if we had anything to add, any parting words that we wanted to leave for our audience, that we share them now. Anybody wanted to share anything additionally?
I would say just because I support and serve youth in so many different capacities, that is the thing that I'm most passionate about, because our youth is the next generation of what's to come. And if we want to start breaking down these stigmas and these myths, then we have to start early. That was part of the reason also that I wrote the book, and I targeted a male character. I targeted the challenges that he was having in school, because the education system is also a factor in our mental health challenges, and being able to address things early. To me, books are a source of content that you can be talking about some challenging conversations, but relating that to a character so that it doesn't feel so personal for you, that you can start to actually have those conversations. And I would just say start doing it early, because I came from a household where you are seen and not heard. Like, Khadija mentioned, and we mentioned early in the conversation, kids are often shut down when they're coming to you to try to tell you how they feel. And that's unfair to them because we all have feelings. And so when your child comes to you and says, I'm sad, or they might not even say I'm sad, I'm upset, they acting out, they doing what they normally do or what they're doing. And instead of being punitive or ignoring them, start being intentional about having those conversations with your children, because that's when they start to learn how to identify some of those actual words. Instead of you going around kicking and hitting and throwing or whatever, having a tantrum, your first reaction might be to yoke them up and listen, I'm about to beat your tail. Sure, okay, that's kind of just what we learn within our culture. But instead of doing that, like, listen, I need you to sit next to me and I need you to talk to me and tell me what's going on. You don't have the language, let's talk through it. Do you feel sad? What does sad mean? Do you feel lonely? What does lonely mean? Start using that language so that it can be language that our children are learning, and our children grow to be teens, young adults, and then that's how we start to break those stigmas and break those generational things. And also, as the adults in our children's lives, we know we don't have it all together, just like Tamika said. Your children may be too young to be able to really understand fully, but as long as you start to have those conversations, it becomes more commonplace. Like, mama went to therapy today, and I need to go to therapy because life is hard sometimes. And I love you, and I'm supposed to be here for you as the adult that's taking care of you. But sometimes it's hard for me to do it because it's so much of a heavy weight, and I need to talk to somebody. And then again, that breaks down those stigmas about, oh, my mom goes to therapy, and I see my mama every day. My mama not crazy, so therapy might not be that bad. And you got to start making it more commonplace and very early, so that, like I said, those children that are growing up into adults will be able to already be functioning in a healthier way.
My closing thoughts would just be to piggyback off of what you said, and that's, you have to start with them early. I was one of those parents, Tasha, where, my children, my son told somebody else that he couldn't talk to me. And that was my first reaction to yank him, because it's like, how dare you tell somebody else that about me? But it came from somebody that I love dearly. And she was like, sis, she was just like, just talk to him, just talk to him. So
Mm,
from that was a turning point in me and my son's relationship. My son is 15 years old, ready to be 16. We lived in Fairfield Court housing project for 5 years. He could have easily turned to the streets, but I think me having that conversation with him and actually letting him have a voice, as opposed to just telling him sit down and be quiet, like you don't pay no bills here. Like that's how I was. I was that parent, and
mm,
I've changed. I've caught a lot of flack from the community, because I don't with my children anymore. I talk to them. My daughter will tell me, "Ma, I'm having a bad day. Like this just ain't it." And it's like, why? What's
mm,
going on? Like, I give my children the freedom to have a voice in my
mm,
household. And the only other thing I would say is parents, please put yourself first. We always say our children come before anything, but the only way our children can come first is if we put ourselves at the top.
mm.
I made that decision of, just constantly being on the go, being on the go. I ain't taking no time for self-care. My kids is number one. And I end up in the hospital. Now
Yeah,
who gonna take care of the children that is so supposedly number one to me?
yeah.
Nobody can take care of my children the way I do. And from that moment on, I made a decision that I was gonna put myself first. Me putting myself first is putting them first. So
Absolutely.
I would just
Like that.
that's how we continue to change these narratives and these myths and these stigmas. It's okay to put ourselves first. We ain't being selfish.
Mm-hmm.
It's necessary. That's the only way we're going to begin to build our communities back up. Is we got to take care of ourselves first.
Mm-hmm.
I agree. Thank you,
And lift
ladies.
each other up in that same way. Because again, we so used to just doing things ourselves and going about our business and not developing a sense of community and a tribe, because it takes a village. It takes a village to not just raise a child, but to survive. So keep checking in with each other and don't just settle for I see you and I see you or text message. Sometimes you got to take the time to actually pick up the phone and talk to somebody. Go by and visit. Don't just text, go visit. I'm gonna show up and I'm gonna see how you doing. Because again, we could keep those things to ourselves, and on the outside it looks like we all good. But sometimes it takes being intentional about having that moment of privacy and togetherness to feel comfortable to have those conversations. Be a neighbor, be a community advocate. If you see something, if you see somebody that's struggling, don't just sit idly by and watch it. Take some time to yourself to say, you know what, I'm gonna go down to Miss Pat house because I ain't seen Miss Pat in a few days. Or I'm gonna go down to Mr. So and so house. I'm gonna go down to Mr. So and so house because I noticed that his children haven't been getting off the bus and I don't know what's going on with them. Or my child told me that their child got in trouble. Now you got to be cautious about how you approach that conversation, obviously, but go and actually have the conversation so that people know that there are people out here that care about you, that are coming to see about you, and that you're not alone.
Absolutely. Thank you, ladies.
Thank you.
So we've come to the end of our time, and I just want to thank you, Tasha, and Kanika, for being a part of this conversation. And thank you both for all that you do in your professional and personal lives. And I thank you to everyone for tuning in. We hope you found this conversation informative and encouraging. We will be back next week for the next conversation in the Mental Health Advocacy Series. Take care, and we look forward to staying connected with you.
Yes, everybody be well.